Hi, everyone. As you're coming in the webinar room, I want to welcome you and thank you for joining us today. My name is Marche, and I'm the webinar director here at Advice Chaser. Before we introduce our guests and get started, I do need to do a bit of legal housekeeping. Advice Chaser, the host of this webinar, is not a registered investment advisor. We cannot and do not give financial advice. Today's presentation is for educational purposes only and cannot be considered advice for any person's individual situation. Advice Chaser regularly hosts informative webinars, such as this one, featuring a variety of knowledgeable professionals, many of whom are licensed advisors. Any opinions, ideas, jokes, or principles expressed by presenters are their own, and however true, funny, or interesting, are not endorsed by Advice Chaser. Please do not act on the information you hear today without consulting a qualified financial professional. We are thrilled to bring you this educational presentation today. Attendees are muted, but we do encourage you to ask questions using the chat box. The presenters will answer those queries during or after the webinar today as appropriate. If you ask a question in the chat box, go ahead and leave your contact information as well. If we can't get to your question, we'll make sure someone reaches out to you after today's event. We want this experience to be as educational as possible, so please don't hesitate to ask for clarification or expansion of the material. Well, I'd love to introduce you to today's moderator and presenter. Our moderator today is Sheldon Sweeney. Sheldon is extremely passionate about helping families and their children with special needs. He connects with them on a personal level because his youngest daughter has Down syndrome. Sheldon has taken a unique path to arrive in the financial services industry. After graduating from California Maritime Academy with a BS degree in nautical industrial technology, he worked in the industrial marketplace for many years. Ultimately, his love for client service led him to a career in financial services as a protection specialist with a major fraternal insurer. However, he found he couldn't fully service his clients with their limited insurance options. Sheldon enjoys helping families who are planning for retirement, as well as business owners who need advice on creating an exit plan while protecting the business they have built. Starting in 2012, Sheldon built his business at Pacific Capital Resource Group, Inc. in Bellevue, Washington as a financial advisor, establishing niches. Sheldon then received an opportunity to move his business to Snyder Financial Group as a wealth advisor in 2019. Sheldon holds 3 designations: the Chartered Special Needs Consultant, the Retirement Income Certified Professional, and the Chartered Financial Consultant. He's also life and disability licensed. So Sheldon, I know that's a lot of credentials I talked about, but I love for people to see your face. So would you please go ahead and say hello?
Yes, Moshe. Hello, I'm Sheldon Sweeney. Look forward to be with you here today and listen to Darcy's topic.
Thank you so much. I'd love to introduce our presenter now. Darcy Geyer is the principal and founder of Geyer Benefits NW. With over 25 years of experience in the insurance business, she is passionate about bringing a personal touch to the process of securing the future. She is Washington Health Exchange certified and Medicare certified. Darcy considers herself a benefits geek and is passionate about making sure people are covered. She provides comprehensive solutions by staying up to date with insurance laws, ensuring compliance and business policies, and making sure people understand policies completely. As a mom of a child with special needs, Darcy also has a passion for helping other families in similar circumstances. Darcy, we're so excited to have you, and I love that you said you're a benefits geek. And so we're going to go ahead and turn over the time to you.
All right, well, thank you so much for the lovely introduction. I just want to say I'm really happy to be here. I am a benefits geek. I do like to deep dive into people's policies and really try to help explain a very confusing world of insurance and help bring families and individuals peace of mind. So today I'm going to talk about Medicare, and I'm going to do a special emphasis about Social Security disability income, because it's another time in your life, if you are under age 65, that you will have a chance to apply to Medicare. Just some fun facts and information. Medicare started in 1965 with the Social Security Act. And these days, with our baby boomers, every 8 seconds, one of you may become eligible for Medicare. What is Medicare? So some of you might have private insurance under your employer. Some of you might have your own individual insurance. Medicare is a program that is funded by your taxes that you've been paid while working. It's called your FICA taxes. And it's the government that turns around and provides medical insurance for people over age 65 or for people under age 65 with disabilities. So we're going to talk a little bit about Medicare and Medicaid eligibility for those on SSDI. So what I'm talking about is if you have been on disability payments with Social Security for over 24 months, you are then eligible for a special enrollment to join with Medicare. The Medicare can be in addition to other medical insurance you may have at the time. One thing to talk about, though, is that a lot of people on disability don't pay for private insurance or a private individual insurance plan. So they might be on something called Medicaid. Here in the state of Washington, it is also called Apple Health. And there's other states that might have another name for their state Medicaid programs. So something to distinguish: Medicare's federal, Medicaid is a state-run program. So there's two differences and they sometimes overlap. You might hear something called a dual eligible special needs plan, or you might hear the term DSNP. And a dual eligible special needs plan is a Medicare plan that can coordinate benefits with your Medicaid plan. And there may be different criteria for you to be eligible for both. So I do want to bring it up because this is a big part of a lot of people that do have a disability for under age 65. So again, you can become eligible if you're younger than age 65 and you've been on Social Security disability payments for 24 months. Medicaid coordination and eligibility with a Medicare program will vary state by state. So you may be eligible where you live in one area, or you may not be eligible in another state. Recommendation is to contact the state Medicaid office and find out what the eligibility criteria is. One nice thing is when you do coordinate those benefits, you can usually own a home and you can own a car and you can still be eligible for a dual eligible special needs plan. If you are under age 65, you don't necessarily have to sign up for a dual eligible special needs plan, but there are other Medicare plans that are available to you as well. So you're not just stuck with this one choice. I don't know if anyone's looked at that, but that's what your Medicare health insurance card will look like once you receive it in the mail. And what I'd like to point out is that this is your card for you to be able to sign up for additional Medicare health insurance. This is the card that's issued by the federal government. You do have to sign up for it. When you see that, you'll see something that says Hospital Part A. and coverage date here says March 1st, 2016. So that could be the month that you turn age 65, or it could be the month that your disability becomes eligible. Medical, which says Part B, often starts at the same time, March 1st, 2016, or it can start at a different point in time, and that's where we're going to explain those differences going forward. Original Medicare, which started in 1965 and has had various changes throughout the years, but the original Medicare, what we say Part A, is what covers hospitalization. So it's going to cover if you spend the night in the hospital and stay 1 day or 2 days or 60 days. It covers skilled nursing after you've been to the hospital. It covers hospice for end of life. And most importantly, it covers 3 pints of blood. So I just think that's kind of an odd thing, but maybe in 1965 that was very important. Part B, which came later, in the 1980s, when medical insurance and medical costs kept spiraling, covers doctor's office visits, and it also covers outpatient surgery. Part D, for drugs, started around 2006 because the cost of prescription drugs kept spiraling again. That covers all of your prescription drugs. So when you are eligible for Medicare, you usually get those 3 parts as part of the original Medicare. So again, Part A Medicare, the original first one that started in 1965, hospitalization, skilled nursing, hospice, 3 pints of blood. That's what you've been paying with your Social Security all these years. So every time when you get that check and you're seeing all those things taken out of the government, that's one of the programs that is being paid for when you turn age 65. Now, there's no additional monthly premium that you have to pay. You've been paying it in for 10 years or 40 quarters, or your spouse has been paying into that. It does have a deductible, however. So if you are hospitalized, right now for 2022, you do have a $1,556 deductible each time you are going into the hospital. So if you're hospitalized 2 or 3 times within that first 60 days, no additional $1,500. However, 6 months later, you would have that deductible hit again. Again, there's more co-payments from days 61 through 90. You see at $389 per day, days 90 through 157, $78 per day, and then after 150 days in the hospital, you pay full cost. What I'd like to say here is you can see on original Part A Medicare, you can continue to pay. There's no stop loss. There's no what we call out-of-pocket maximum. So keep that in your head, out-of-pocket maximum, because that's important as we go forward. Part B Medicare. So Part B Medicare, again, covers with the cost of doctor's office visits. It may cover outpatient surgery. That premium will be deducted either from if you're receiving a Social Security check, or so if you're disabled, from your SSDI check each month, they will be deducting a certain amount of premium from that check. If you are currently still working, or you are not taking a Social Security check yet, if you, let's say you're turning age 65, then the government will bill you for the first 4 months of that paycheck. Of that premium. Under Part B, you do have a small deductible. It's $233 as of this year. And after that $233 deductible, then you have to pay 20% of the bill. Again, no cap on total spending. So remember that. I've got no out-of-pocket maximum. So you could be spending 20% the entire year, under an original Medicare plan. Nice thing about Part B Medicare and original Part B Medicare and original Part A Medicare is you can go to any doctor in the United States that accepts Medicare. So you don't have to worry about any networks or closed systems. Another nice thing is if you are over age 65 and you still have employer health insurance, and there's a term called credible coverage, we'll go over that in a minute, you can actually delay enrolling in the Part B. So that means that you don't have to start paying that Part B premium, which right now is about $170 a month for most people. When you do retire, let's say you stop working at 67 or 70, then you're going to have to work with your employer to send in some information to Medicare stating that you now no longer have employer-based coverage and you are now going to sign up for Part B and enroll. And you've got 6 to 7 months to do that after you leave your employment. This is kind of giving you an idea of what Part B monthly premiums look like. Last year in 2022, it went up significantly. So if you look at the file of individual tax return, there's joint, filed joint return, and then filed married and separate tax returns. You're going to look at your monthly payment. So for most people, they'll be having a Social Security deduction of $170 a month. As your income goes up, you can see the premium goes up to $238, $340, $442, $544, up to $578. Most people, when they retire, all of a sudden, they're not making as much money as they did when they were working. However, Social Security, when they decide how much money they will be taking out of your Social Security check, are looking at your income from 2 years ago. So for 2022, if you are eligible for Medicare, they will be looking at your income from 2020. So that's just can be a little bit of a shock for people that are looking maybe on living on, a little tighter budget now that they're no longer working. So that's something to be aware of when you are planning for your Social Security. Okay. So Part D Medicare is something called the standalone prescription drug coverage. And you might see this term PDP, prescription drug coverage, very original. You got to sign up for Part A, or you have to be able to receive Part A. Let's say if your spouse has passed away, but you are under their plan. So you must sign up for Part A for sure. You don't necessarily have to sign up for Part B to get Part D. The Part D Medicare plans are not, you don't get it through the government. The government will send you over to a private insurance company, and there are many companies that offer Part D or prescription drug coverage at different rates. And what is important when you go and you're ready to do your homework about which insurance company gives me the best coverage, there is a Medicare.gov website. You can put in the names of all your prescription drugs in there, and they will bring up the plans based on cost, the least expensive coming first. That will show you the best choices for you in picking a Part D prescription drug plan. Now, insurance companies must offer all of the Medicare drugs that Medicare approves of. Doesn't mean it's the brand name. It could be a similar prescription drug. So most often you'll see the best pricing on generic drugs, and one insurance company covering one generic drug might not be the same generic drug in a different insurance company. So just kind of a heads up when you start looking at that and what the costs are. What Part D does is it subsidizes the cost of your prescription drugs by an annual deductible and co-payments. So for example, if the drug retail price is $100, you might only be paying $3 to pick that up for a monthly fee. Part D cost sharing. This is rather complicated, but I do like to explain it because sometimes people can be blindsided by this. As I mentioned, there is a prescription drug annual deductible. It's up to $480 for 2022. It's going up to $505 for 2023. What does that mean? What you will see in most prescription drug plans is drugs are in tiers, tier 1, 2, 3, 4, 5, and 6. Tier 1 is usually generic drugs. They say preferred generic drugs. Tier 2 may be just generic drugs. Tier 3 may be preferred brand. Tier 4 brand. And there's various payments on all those drugs. So most generic drugs may cost $2, $3, $10. Preferred might cost a little bit more. Brand might be $40. Preferred brand might be $60, $100. When you're looking at that annual deductible, that usually only goes towards tier 4, 5, or 6 drugs. The other drugs might have co-payments, but it doesn't go towards that annual deductible cost. When you're looking at these big numbers down below, it says initial coverage limit of $4,430. What that means is that's the retail cost of the drug. So for example, I'm a type 1 diabetic. My prescription, my insulin costs $300, but that's the retail cost. However, I'm only paying $60 for the drug. So the federal government, though, is looking at my retail cost, and as soon as it gets up to $4,430, my prescription drug costs go into something called a donut hole or a coverage gap. And I might be paying a little bit more than that $60 during that donut hole time. I will be paying a little bit more until I reach that retail cost, that catastrophic coverage cost of $7,000. So if you've got somebody that might have a very expensive prescription drug, you might reach that immediately, or it might take a few months. So once you hit that catastrophic coverage, then your drug copays drop down to generic of $4.14, brand name $10.35. So that's something to be aware of if you are taking a very expensive prescription drug, is to be aware of this donut hole. It can be a little bit confusing, but I'd say most of us fall under where we're just paying a copay for a generic drug and not having to worry about the deductible. But if we're working with families with special needs, or we're working with people with disabilities, this might be a very important factor in looking at what kind of prescription drugs that may be needed for people and families with disabilities. There are two kinds of plans above and beyond the original Medicare that the government provides, and I'm going to call them option 1 and option 2. There's something called Medicare supplemental plans, or you might hear the term Medicare gap plan. So a supplemental plan is offered through a private insurance company, and they help pick up part of that cost sharing in the traditional parts of A and B. So they pick up that $1,500 deductible for hospitalization. They might pick up 20% of the cost of the Part B, the visiting the doctor's office visit. They have 10 standardized plans with very original names of Plan A, B, C, D, E, F, G, up to Plan N. Most states will only, or most insurance companies will only offer maybe 3 or 4 plans. Why do people pick these plans? It's going to cover your hospitalization, your doctor's office visits. You know exactly what your monthly premium is going to be. And then you might know what your co-payments will be. It offers the flexibility that you can see any doctor nationwide that accepts Medicare. If you're living in a rural area, it might be the only plans that are available because you don't have a huge doctor network. The thing about the supplemental plans, though, you have to purchase a separate Medicare prescription drug plan. So you've got one plan, the supplemental plan, covering Part A and B. You have a second plan covering Part D. What supplemental plans do not cover is any other additional bells and whistles. So they don't cover vision, like if you need glasses. They don't cover dental coverage if you need work on your teeth. Some may cover gym memberships, they may not, depending on the carrier. So it really is, in some ways, kind of the bare bones basic for medical coverage. Medicare Part C, or you might hear the word Medicare Advantage plans, are a little bit different. They're different than the supplemental plans. They can offer more comprehensive coverage. They might cover the prescription drug coverage. They have to cover Part A. They have to cover Part B. Some of the Medicare Advantage plans will also cover Part D, so you're not paying a separate premium. It has a cap on the total out-of-pocket medical expenses. So if any of you currently are on a PPO or an HMO plan, the Medicare Advantage plans offer pretty much similar kinds of coverage. You're going to have co-payments, you might have some co-insurance. They also may offer additional benefits like dental coverage, vision coverage, hearing aids. Most of the plans will offer a free gym membership through Silver Sneakers or other plans that are directed for people over age 65. The other nice thing about Medicare Advantage plans, some may have a $0 premium, so you're not paying additional monthly premium, or they might have a very low premium, $20, $30, $40, $100 or more, depending on which Medicare Advantage plan that you choose. So one thing I'm going to say, what's different with the Medicare Advantage plans versus the supplemental or the gap plans. One, Medicare Advantage plans is basically the U.S. government said to the private insurance companies, we want to get out of the claims business. We don't want to be paying claims on Medicare. So we're going to pay you, the insurance carrier, say $800 a month, and you are in charge of paying the claims and helping, monitor the overall cost. What in exchange is that these Advantage plans have networks of physicians and hospitals that they contract with. So what they let's say, if you're familiar with an HMO plan, is that the care outside of the network is not covered unless it's in an emergency. You usually have to pick a primary care doctor. That can be an internist, a GP, a family doctor, and that primary care doctor will then do the referral and help coordinate the care for specialists. These plans, though, you're paying a $0 premium or a small monthly premium. Again, talked about having additional benefits available. However, for an HMO plan, you really have to be living in that area. If you go outside the service area, again, you're not covered unless it's in place of emergency. So if you're spending part of your time in another part of the country, this plan is probably not the best choice for you. There are another Medicare Advantage plans called PPOs, Preferred Provider Organization. That does offer both in-network and out-of-network doctors and hospital coverage. So you'll have a higher copay for out-of-network care. You'll have a lower copay or coinsurance for in-network care. The other nice thing about a PPO plan is if you're working with a nationwide insurance carrier, is that PPO plan can travel with you if you decide to spend half the year or part of the year, say you're visiting your kids, or up here in the Pacific Northwest, you're tired of the rain and you're going to Arizona for 6 months. This PPO plan can travel with you, very similar to the supplemental plans. So a lot of people like the flexibility of these PPO plans because they are still less money than the supplemental plans for monthly premium. However, you do have copays, coinsurance, and both HMO and PPO plans, as we say, have that stop loss, that out-of-pocket maximum, that after you pay that amount, everything's covered at 100%. The other nice thing about the Medicare Advantage plans, we talked about dental, vision, gym. I forgot to mention some of them offer massage, some have chiropractic, some have acupuncture. Some will offer meals, after you get out of the hospital, or they'll offer transportation. They'll have somebody, if you can't drive a car, they'll have a transportation to pick you up and take you to your appointments. So there's a lot more bells and whistles with the Medicare Advantage plans. Okay, off we go. Next page, please. So in conclusion, we basically have three choices. You've got original Medicare, Part A, Part B, Part D. Claims are administered by the federal government. You have the supplemental plan. It has higher premiums, but it might have more comprehensive coverage. For example, you might only pay that $233 deductible, and that's all you pay for the entire year. You can go to any doctor who takes Medicare. You do have to buy a separate standalone Part D plan, and it only covers original Medicare benefits. So no special chiropractic, no acupuncture, no massage, no vision, no dental. The Medicare Advantage is more of a structured program. However, you pay low or no premium. It's more like pay as you go. So if you go visit the doctor, you might pay a copay. If you go to the hospital, you might pay a copay. You have to use the network provider. It has that built-in Part D, so you don't have to buy a separate prescription drug policy. And it might offer the additional benefits like the dental, the vision, the gym membership, massage, etc. However, you do have to make sure that you live within that network. How do you enroll in Medicare? I can't do it for you. You do have to go to socialsecurity.gov and get to their webpage, and I joke, scroll down to the very bottom of the page where it says enroll in Medicare. There's a tab down there, especially if you're not taking, now if you're taking Social Security checks, if you're under SSDI, you can enroll through there. Otherwise, if you're not taking a Social Security check yet, you go down to the bottom of the page, click, hit Medicare only. So when do you get to enroll? When you turn age 65. So when your birthday is coming up, let's say your birthday is January 1st, you can enroll up to 3 months before your birthday on up to 3 months after your birthday. So you have a 7-month window of when you can enroll into your Part A and your Part B. If you do not have employer-based insurance right now, if you don't enroll in that 7-month window, you will get a penalty for not enrolling in your Part B and your Part D in a timely manner. If you are working for an employer that has 20 or more employees, you don't have to sign up for Part B, but you will need to sign up for Part B after you leave your job. And again, you've got that 6-month window. If you're under age 65 and you've been disabled and received a Social Security check for 24 months, and you have Social Security benefits, you will be allowed to sign up at that time as well. So a few things. Everyone who's turning 65 will automatically be enrolled in Part A. You have to enroll Part B upon your eligibility. So whether you're leaving a job, turning 65, getting married to, let's say you're a foreigner and you're getting married to somebody here, you do have an option to change plans every year. So you've got what we call initial enrollment period, that for 6 months. And then if you enroll in a plan and you're not happy with it, or you want to get a better plan, every year you have an opportunity to make a change. And that right now, and that's mostly for the Medicare Advantage plans. October 15th through December, we call that the annual open enrollment period. And that's the time when you can review your current plan to see if there's major changes for the next year, or look at other plans at that time. So that's an important time to always kind of keep in your head once you have signed up for Medicare, is that you've got that option to make changes at that time as well. Okay, I'm gonna just tell you. So there's other times when you're eligible for something called a special enrollment period. If you're moving out of the area, the plan no longer is being discontinued, or you have a health issue, all of a sudden you now need skilled nursing care, or you've lost, your income has changed. Those are other times outside of those annual open enrollment periods where you can make changes. You also, a big thing to look at is if you are low income or you do receive Medicaid, I always recommend contacting the state to see if they can pick up some of your Medicare costs. And that's where that dual choice comes in. So I want to thank you for your time. I'm happy to take questions. I do want to point out 2 resources that are super important. 1, Social Security Administration. That's where you're getting your check. 2, that's where you sign up. That's the initial place where you sign up to get your Medicare card. There's a wonderful Medicare website. That website you can look online, and that's kind of like a big super highway. It will show you all the local plans in your area, and it will also allow you to go shopping for the plans, and it will also allow you to put in all your prescription drug medication to take a look at plans that would be most beneficial for your needs. So those are 2 important places to take a look at when you are going down your Medicare path. So
All right. Well, we have gathered several questions for you, Darcy, and I know Sheldon's going to handle asking these, and we'll go ahead and open up the floor for question and answers.
Okay, so I just wanted to also say again, this is Sheldon Sweeney, and as a financial advisor, I really value someone with Darcy's expertise. There's times as I'm walking through a financial plan with someone, and as they're aging up and getting close to Medicare, or even when they're in their late 50s and we're forecasting what is your retirement cash flow going to look like, I need to estimate numbers for Medicare. And then, as you can hear from the many different supplements that are offered, it's a very confusing time for people. So it's, I would say, just in a broad sense, you should ideally, if you're working with a financial advisor, you should tap into their resources. Most financial advisors are going to have broad networks of people to go to, and they should always have a good Medicare person like Darcy on their list that you can get in front of. So in terms of questions, Darcy, these are some great questions that came in. I'll read it off to you as it's worded. If I'm still working and have insurance through my employer, do I have to apply for Part A when I turn age 65?
Okay, So if you are still working and you've been working, let's say for over 10 years, you automatically get the Part A. So you don't really have to do anything. I do want to qualify though, if you are working for an employer under 20 employees, you still have to sign up for Part B. If you are working for an employer with over 20 employees, you can wait. So what happens in that circumstance, under 20 employees employer, Medicare is the primary, pays for your medical care. They're the primary carrier. And then if you continue to stay on your employer's plan, you can opt off of it. They will be the secondary carrier. If you work for an employer with over 20 employees, so here, let's say in our area, I'm in the state of Washington, we've got Microsoft, Google, Amazon, all these large companies, or even if you work for a company with 21 employees, you can delay signing up for Part B. Your Part A is at no additional cost to you, so it will just happen automatically.
Thank you, Darcy. Another good one here. If I am 60 years old and I have Medicare, I cannot purchase Medicare supplement plans, correct?
That is correct. So
Okay.
if you are if you're under 65 and on Medicare right now you cannot buy a supplemental plan, at least I know here in the state of Washington. You've got to wait till you hit age 65 and then you can switch over to a supplemental plan.
Okay. And that's what, from those reference numbers that you gave earlier, people could probably reach out if they wanted more clarification on that, right?
Right. And you know what? You can always go to that Medicare.gov website. It may have some additional clarification on that for you.
All right. Thank you, Darcy. And then we have one more here. Two more, actually. And this one says, my wife does not have enough credits to get Social Security benefits. Can she get Medicare or Medicare Advantage?
If you, the spouse, have received those credits and you've worked those hours, then if she's been married with you for over 10 years, she will be able to get those credits based on your work history.
10 years of marriage. Okay.
Yeah, so you got to stick with it. 10 years. Okay.
Very good. And then, Marcia, are we doing okay on time? It looks like I just have.
Yeah, you know what? We'll take as many as we can. I know I gathered a couple more, so let's go ahead and take, we'll do another 5 or 6 minutes of this.
Okay, thank you. Darcy, this one says, does Medicare cover couples or individuals?
Yeah, I don't know if you're talking if you both have to turn age 65. So let's say I've got a couple, one's turning 65 and one is 61 years of age. The 65-year-old person would go on the Medicare benefits. The 61-year-old would have to stay on individual plan. When both couples are at age 65, you both can pick completely separate Medicare plans. You don't have to go on the exact same plan. You go on the plan that meets your individual needs.
All right, the next one, Darcy, it says, I have primary insurance from my work and I have secondary insurance from my wife's work. Can I apply for Part A also?
You can, yeah, so the Part A, as I said, will start automatically and you can delay signing up for the Part B.
Okay. Next one, can you sign up for your Medicare coverage if you have missed the initial enrollment period?
Yes, you can. So I would go ahead and see if you can sign up as soon as possible, because each month you delay, you get, I think it's an extra I'm getting it confused. 1 to 10% more on each month you delay getting on.
Okay.
So there is there can be a fairly hefty penalty, and I'd like to qualify that because
Yeah.
there were a lot of people, let's say, signed up for Part B, but they never signed up for Part D, the prescription drug. So a lot of people decided there's just too much of a penalty on Part D. I'll just never sign up for it. If that happens to you, where you feel it's cost prohibitive to sign up for Part D, there's other workarounds trying to get prescription drug coverage, but I highly recommend there's some very inexpensive Part D plans if you're not taking any prescription drugs right now, to be able to sign up for that. It's really not much out of your own pocket.
And then let me ask this. This is kind of more from my perspective. So if you could explain to everybody the importance of doing an annual review with someone like yourself to make sure you're in the right position, and maybe that even addresses that issue with penalties, right? Because it can literally change year over year.
It can, and I mean, so often, I have clients, perfect health, everything's great, they're out running, walking, traveling, and boom, an event happens, and all of a sudden your needs change. Or there's some new plans that really have some new bells and whistles that your old plan doesn't have, that you might want to take advantage of. So it's always a good time to get together with your broker and talk to them about if your health has changed, or you're moving, your needs are changing, you've got plans, you're like out of here and you want to move down to Arizona, or you want to go to Florida, talking about whatever your needs are happening at that moment, it's a good time to review that. Thank you.
All right.
I think we have time for just one more question here, and then we'll go ahead and close.
Okay, so we'll consider this the final one, Darcy, and here's how it's worded. It says, if Medicare premium is calculated based on 2 years prior income, can this be adjusted to current year's income if you're already retired and do not have that high income?
Let me make sure I understand that. If you're currently retired, but 2 years ago you were not, or you were retired?
It looks like, I'll go from the top again. If Medicare premium is calculated based on 2 years prior income. So is that statement true? Is that a fair assumption?
Right. So if you sign up for 2022, you're Medicare eligible in 2022, they're going to look at your income from 2 years ago of 2020.
2020. Okay.
So it could be a little bit of a bind, as you said, because somebody's now retired and they're not pulling in that money that they were 2 years ago. Yeah,
so I think that's the essence of the question, because then it says, can this be adjusted to current year's income if you're retired and do not have that high income? Or is it always going to look,
wait? Yeah,
always goes back to that 2 years.
Right.
So
or, right. So what they do is they'll look at your tax returns and say, okay, your Medicare Part B premium.
Yeah. There's nowhere to hide, no options on that one. It's just a hard. Yeah, I mean, there's probably other examples like that as people transition into retirement. Sometimes there are just costs. There's no way around them. So the best thing is to know about those like 5 years in advance and say, maybe we've got to bank some extra money to, cover that, and then things will ease down. Premiums will drop down as you roll past that 2 year window.
Correct.
Okay.
All right. Thank you so much. We'll go ahead and close question and answer time out now. Now, we may not have been able to get to your question. And if you will go ahead and ask your question in the chat, I will go ahead and save these questions, and we'll make sure someone reaches out to you after today's event. We're sorry we don't have time to spend on everything, but we would like to, of course, acknowledge your time and our speaker and moderator's time. So on behalf of Advice Chaser, we want to thank Sheldon and Darcy for being here, and for the organizations that have made this webinar possible today. For our attendees, thank you so much for attending. And you can look forward to a link to the replay of this event in your email soon, and you can share that with your friends and family. Here at Advice Chaser, we're all about helping you find a financial advisor who's a great fit for your life and your financial questions. Our matching service is free to you, and every one of our advisor partners has committed to offer a free initial consultation to anyone we introduce them to. Find out more by going to advicechaser.com and clicking on the link to find an advisor. Once again, from Advice Chaser, thank you so much for coming, and we will see you at another webinar soon. And I wanted to say to our speakers here today, we've gotten some thank yous in the chat specifically. So again, thank you everyone, and we will see you at another webinar. Bye everyone.